Welcome back to The Miracle Moment. My name is JJ. I am your host, and I have the pleasure of introducing once again Dr. Kenneth Orbeck. Hello, Dr. Kenneth.
Good morning. How are you doing, JJ?
We are doing amazing, and we're so excited to have you back.
We're going to have a fun time today.
As always.
Today we get to dig deeper.
Okay. Ooh. We promised the audience that they would get to learn a lot more. So sounds like we're going to deliver on that.
We'll have some fun.
Okay. So let's talk a bit about the cellular city. We discussed that last time, and you explained how important it is to have a healthy cell, a healthy balanced cell.
Absolutely.
And also we discussed the importance of communication and that cell-to-cell communication. Let's pick up there, if you can, and explain a bit more about what that means to your audience.
So yeah, cell-to-cell communication in the body is imperative. It's very, very, very important. And as we age, we may lose some of that cell-to-cell communication, especially through hormonal optimization, right? Because as the hormones decline, there's going to be a problem with the cells communicating to each other and to the body on how to keep the body building the way it should with protein. So cell-to-cell communication is critical. Okay,
so you mentioned the importance of it communicating around protein, for example. Are there other areas that our cells communicate to each other around that are important for us to know when it comes to coming to see you and understanding how this works?
I think one of the most important parts of anti-aging and age management medicine, because all of us really want to look better and live longer, is the importance of your body being able to build protein. And one of the most important, aspects of the cell is to build protein, right? So inside the cell, it has to be giving those cell signals. That occurs at the level of the DNA. And that's where I'd like to really kind of dive in and talk about, cell communication through hormonal therapy and hormonal optimization as we start to see our hormones decline. And it happens in everybody. I mean, as we get middle-aged, into the upper 40s, low 50s, hormones start to decline. And that's a problem because we talked about before the differences between anabolic and catabolic. Catabolic being the body breaking down, anabolic being the body building up. So I think we should focus a little bit now on how do we maintain the anabolic metabolism, good cell-cell communication, and allow the body to be more proactive in building protein, maintaining muscle mass, maintaining bone, supporting the brain, supporting the immune system. That's all important.
Okay, what hormone helps us do that we should start talking about first?
I think we need to talk about the sex hormones of the body that decline as we age. Men's testicles will start to decline and they'll start losing testosterone. Women's ovaries will start to decline, and so they start losing their hormones, which includes estrogen, progesterone, testosterone. And as that happens, women go through menopause and men go through andropause. And when that happens, you watch an individual and their body configuration starts to change. They'll start to lose muscle mass, they'll start to gain fat mass. And more importantly, you're also going to see these people with psychological issues too. They don't have that energy and that vitality and that spark and the ability to perform the way they used to perform. So that's really important. So the hormones I'd like to talk about would basically be the sex hormones of the body as we age, and then the different types of hormones that are available, and which ones I think and have been proven to be more effective.
Okay, so when this cell-to-cell communication starts to decline, and you notice, you go through the gauntlet of testing that we said in the beginning when we discussed how important it is for you to understand the baseline of where your client is at. And what will happen next for them when we talk about testosterone, for example, as far as your therapy and how you help that individual regain that cell-to-cell communication?
Well, let's talk about hormonal balance. When we get into hormones, you have, and let's start first of all, let's talk about a woman, for example. And as a woman starts to age and go through menopause, okay, you're going to have imbalances between three basic major hormones. Now, there are many more, and there are a lot of metabolites. We can get into that later on where the hormones go and how they metabolize and how you have to look for safety of hormones. But to keep it more basic today, The three major hormones would be estrogen, progesterone, and testosterone. So let's start off by saying that these hormones, they represent more of like an orchestra that has to be balanced. If you have, for example, a single hormone replaced in the body, that's not very effective. The body won't do well. It needs a balance of the hormones. And I talk to my patients kind of like, I love music, right? And so I go to concerts, I go to symphonies, and the conductor comes out and brings it down his arms, and all of a sudden this beautiful music comes out off the stage into the entire center. And it just gives me chills to hear that beautiful symphony. And I look at hormones the same way. When hormones are balanced properly, you have symphonic music in the body, and your body is then, and a woman can tell this, by the way. They come in my office, and Dr. Orbeck, I don't feel balanced. I say, okay, I listen to you because you know your body. I don't have that symphony, right? But when they are balanced and the music is played properly, that's a beautiful thing. It makes for a much better life. And so the hormones that we need to talk about would be the relationship between estrogen, progesterone, testosterone, and then keeping cortisol at bay, which is a stress hormone.
Now, do all medical practitioners focus on a balance, as you're saying?
I think most should. I don't know if they all do. But, we're talking today more in a functional integrative practice that focuses more on, the age management aspects of the aging process. And I think in that respect, the physicians that are well-trained and experienced in doing hormones definitely have to have the knowledge and definitely do look at balance. I think balance is very, very important. You can't push a hormone to an extreme limit to try to achieve results. It's just not going to work. It's like if you bring a car to your mechanic, right, and all you have is a crescent wrench. That's all you have, and you need other tools, but we're going to fix it with a crescent wrench. You're not going to have the best results. So, in looking at the hormones, understanding how they play a role in the cell, and understanding these hormones' relationships to each other, because they all balance each other, gives you the most optimal outcome that you can get.
Okay, that's good to know. Now, we talked about these three different hormones that we're gonna dig a little deeper into. However, one in particular that you would like to start off with would be
testosterone.
Okay.
Yeah, because that's the forgotten hormone. It's not forgotten in men. I mean, men basically, testosterone replacement therapy is well known today. It's being exercised and practiced everywhere. We'll talk about that later in the aspects of replacing that in men properly. But in today's podcast, what I'd like to do is I'd like to speak about the balance of hormones, and particularly testosterone in women, because it's often a forgotten hormone. It's crazy because approximately 80% of women, as they age into the 50s, into their 50s, are going to be having low testosterone, and so they really are not going to maintain that anabolic metabolism, and that's very important. And the symptoms, what are the symptoms of testosterone reduction? I mean, any woman who's going through menopause can tell you, they're going to have lack of energy, they're going to feel depressed, a depressed mood, they're going to have a reduction in their sex drive, their libido, they're going to have a decrease in their muscle mass, increase in their fat mass, decrease in their muscle strength. Okay, that's important. They're going to develop some bone loss that occurs with hormonal decline, and that turns into either osteopenia, which is the beginning of bone loss, or osteoporosis, which is more advanced bone loss. And it does increase also in a reduction in testosterone, believe it or not, increases coronary artery disease and death. So that's pretty important. So testosterone is really important, and we can get into the aspects of testosterone individually. I'd like to start out basically in talking about the notion of testosterone replacement therapy and the cardiovascular system in the heart.
Okay.
I think that's important. Testosterone kind of got a bad rap in that, if you replace testosterone therapy in the body, Often people are telling me, well, is it bad for my heart? Is it bad for my heart? It is not, actually. It's good for your heart. Endogenous testosterone, it is inversely related to the majority of risk factors in atherosclerosis. Okay.
Okay,
so
break that down for us a little bit.
So basically what I'm telling you is that if you replace testosterone, then developing plaque in arterial disease is reduced, not increased. Okay. There's multiple major analysis regression studies that are done independently, and if we want to get more specific, testosterone is associated with anti-OX LDL antibody, and that antibody is important on the LDL molecule in the developing of plaque. Okay, so that's interesting. A fall in testosterone, especially in aging men, can influence their basically the modification of any immune response of lipoproteins that affect the ability of the body to maintain clean vessels rather than form plaque. Testosterone has been shown to increase coronary arterial blood flow. Okay, so that's good for the heart. And it's also a vasodilator. It works on nitric oxide, NO. So testosterone and nitric oxide therapy in combination is very, very good for the heart. So as far as is testosterone safe in replacement regarding regarding the cardiovascular system? And the answer is yes.
And all of that you just provided, I think, isn't well known, perhaps,
Right.
for the general public to understand how valuable testosterone is both for females and males.
Yep, correct.
This
Exactly.
is really interesting. Now, we talk about testosterone and its importance, and you discover, okay, somebody might be low on testosterone. How do you then help them? What does the therapy actually look like?
Testosterone replacement therapy has different forms, and we'll get into that a little later on how I replace it. I'd like to expand a little bit about different aspects of testosterone. One aspect of testosterone that I really look at, and if we switch to the male patient now, there are two basically key factors that I look when a man walks into my office. I look at their free testosterone and their vitamin D3. And what's really important is that a combination I often see is that a man will have low free testosterone and low vitamin D. This predicts mortality in older men. And that was looked at a study where actually they were referred for coronary angiography. And their cardiovascular system was compromised, and these men had events. And that was associated with low testosterone and low vitamin D. So that's pretty important. Normalizing testosterone levels is critical in the overall body composition as well.
And for longevity, really, this is all for longevity.
Absolutely. Absolutely. Very, very important for longevity, very important for quality of living, very important for health. And then, of course, if we talk about testosterone replacement therapy and, your behavior, it's going to give you a little bit more clarity of thought, vitality, focus, libido, sex drive, right? So all that is really important in quality of living, right?
Yes. It's absolutely important in the quality of living, because if we don't feel happy and healthy and like we've got the energy to enjoy life, it feels like we don't have control.
Correct.
We lose
Exactly.
control.
Yep.
So you're giving somebody back the opportunity to enjoy where they are, where they think maybe they would otherwise not be able to.
Exactly. What do you do for hobbies?
Run, work out. And, it was interesting because I did notice not too long ago where I started feeling a bit more fatigued. I wasn't waking up as early as I liked to. My muscle mass wasn't staying as it used to. It felt like it took more to actually build muscle back.
Do you think testosterone is important for your body?
I do.
Should we talk about that?
Yeah, let's talk about that.
So testosterone in the body is another very important relationship. Testosterone decline is related to reduced muscle mass. It's also related to reduced muscle strength. It's very important when you look at the body's composition. In my office I have body compositional analysis, right? So I want to know my patient's muscle mass. I want to know their fat mass. I want to know their bone mass. I want to know their water mass. If I have two individuals step in front of me, they both look the same, okay? I had this the other day. I saw a woman in the morning, and I saw a very similar woman in the afternoon, okay? They looked the same. They had the same type of figure. They were well-dressed. I'm like, okay, they're pretty healthy people, right? Well, we did a body compositional analysis. The first woman came in, and her total body fat mass, her percent body fat, BPF, was sitting right around 16, 17%. I'm like, that's what I expected. Muscle mass was good. She was active, working out, right? Everything was excellent. Second woman walked in, thought the same thing, right? Percent body fat, 36%. Low muscle mass. So I can't see through the skin with my naked eye and see what the body's made of, all right? So we have different types of impedance scales that we can use, and we can measure that. And when I measure that and I replace a person's testosterone therapy with testosterone hormone, what I notice is a shift in building muscle mass and burning fat. Okay, so we know that testosterone definitely is important in body composition. And we know that if we age and we lack that hormone, we're going to start burning muscle and building fat. You may even wear the same type of clothing. And the scale may even say that you weigh the same amount, but the body composition is not. And it's those individuals as they age, and if they're not proactive and they don't take the bull by the horn and say, I need to fix this. Those individuals, as they continue to go through life and they lose muscle mass, what happens? They become more frail. Because your body's going to weigh something, right? If you build a building, it's got to have a good foundation, right? Well, what happens if that foundation gets weak? The structure may fall. Well, what happens to a human being as they age and they lose muscle mass and strength? They get weak. They can't hold up the weight that their body has. So what do? We give them ambulatory aids, walkers, wheelchairs, whatever. All right? So this is really important when we talk about hormonal therapy.
Well, what's so fascinating is that most people just step on a scale and gauge their health based off of a number.
Exactly.
And what you're explaining is that is not only the metric we should be utilizing to better understand how we are feeling from the inside out.
Exactly. So we talked about testosterone and muscle mass. We talked about body mass. We talked about your mood. Well, now, what about your brain? Is your brain important?
Yes, the brain is absolutely important because without that clarity of thought and mind, we don't really know where to go.
Exactly.
Or what to do.
And what is the number one thing? When you wake up in the morning, what are you afraid of as you age? Is it called dementia?
Oh, goodness.
Right? Everybody's afraid of that.
Sure.
Well, testosterone replacement therapy in the neurological system, it reduces the neuronal secretion of Alzheimer's beta amyloid peptides. That's big. So just by replacing testosterone, you can already impact on the brain and reduce your chances of obtaining dementia. There's evidence to suggest that testosterone insufficiency or deficiency constitutes a risk factor for cognitive decline and possibly dementia. Okay? So this is very important. We have to look at all these types of things. So we talked about muscle mass, we talked about neurological brain health, we talked about vitality, we talked about mood, we talked about libido, sexuality. So this is where I kind of place testosterone hormone in the body in age management medicine.
Thank you so much, Dr. Orbeck, for sharing that insight on testosterone. And what I'd like to say is we're going to take this into the next episode. So we encourage all of you to stay tuned as we pick up next time with the Miracle Moment. Thank you so much for tuning in.
Thank you.